We are live. Welcome to the Council Special Committee on Childcare Centers in Nashville. Thanks for being here. And I'm going to start by both kind of checking roll and if I could get somebody, let me see if I can share my screen. All right, if I could get someone to read the what I have in quotation marks there that starts with pursuant to Governor Lee's executive order, so we can do business virtually.
This is Berkeley, Allen. I'll do that.
Awesome, thank you.
Pursuant to Governor Lee's executive order number 71 regarding electronic meetings, I make a motion that this committee meeting agenda constitutes essential business of the Metro government, and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak.
All right, thank you. And so that has been moved. And can I get a second?
Second.
Where did my...
And Tom, could we move Erica Ward up from an attendee to a panelist? She's...
I think IT will take care of that.
Oh, great. Okay. She's...
All right, thanks. All right,
Perfect.
let me take roll and see who's here. And if when I call your name, if you could say aye or nay that you agree with the motion, that would be great. I support the motion, and I'm here. Councilmember Allen.
Aye.
Emily Pennington Brown.
Aye.
Zaya.
Aye.
Judy.
Aye.
Erica, is Erica with us?
Aye.
Thank you. Lisa.
Aye.
Nancy. Is Nancy with us? All right, and I think Amy, whose name I think I got misspelled here. I think Amy said she wasn't able to be with us today, but did tell me what she wants to work on. Christy?
Aye.
All right, and Melanie's not officially a member of the committee, but is joining us as a guest. Is Melanie with us?
She actually wasn't able to join today, but she's very interested.
Okay, sounds good. All right, thank you. We have definitely a quorum, and we've got our motion has been approved, so we are good to do business. And I'll start with, let me go back to, I'll start with a little update of, I've had several or numerous good conversations with stakeholders in the community. I had a great virtual meeting with Gina Tech of the Community Foundation and learned a lot about childcare in Nashville and the great work that the Community Foundation does. I've talked to several stakeholders in the community, especially some that are involved in community benefits agreements, and they expressed an acknowledgement that we need more childcare centers and enthusiasm to be a part of the dialogue going forward. I've made a request of, I reached out to our director and in the council and the head of codes to get more information on the local codes that might be, we talked about codes that might be prohibitive to starting up childcare centers. And so I'm getting information on that. I thought today that we would look at the goals that we put together last time and kind of divide up the work, see if any kind of go together and we can condense the list, and also kind of talk about which individuals would like to do some research and like brainstorm a list of suggestions or thoughts or sub goals going forward. I mean, our two main, we want to have good discussions and share our ideas. Our two main, I think, tangible things that will or could come out of this special committee are that we will issue a report to the vice mayor. Obviously, won't be just a, just for his eyes, but he convened the committee, so we will, present a final report with recommendations and plans to him, and also, there is likely to legislation is another likely outcome of the committee. So with those two things in mind, kind of work on that report with recommendations backed up with specifics, and then talk about what kind of legislation might be appropriate going forward. All right, does that make sense? Any questions so far? All right. I am going to go to this list, and we still are able to make changes to it if we need to. The first one is kind of a broad goal that all the others, I think, are working towards. So I'm going to skip that for now, but under that, expand home-based care opportunities, micro centers, which we talked about, leveraging private sector, nonprofit, and church resources to find facilities for new centers.
Excuse me, Tom, can you share your screen again? It'd be helpful to see.
Oh, I'm sorry, I hit the wrong, sorry. Do that. I went to the right.
Tom,
Yes.
this is Lisa chiming in here. I hope you can hear me okay. Okay, good. I wanted to, while you're bringing that up, sort of suggest / update the group.
Absolutely.
And I would invite Erica to add in or join. But we have been working together on the second bullet, expanding home-based care opportunities, and Erica is actually doing that for own home-based care. But we are in the process of working with MDHA to look at possibilities of home-based care in affordable housing areas and communities. And so I might suggest that there's a kind of subcommittee or group, or however the group wants to do it, that there's like a kind of mini group that's just looking at home-based family care. Okay. And I say that because it's a different animal than center-based care. And there are different requirements and different ways to go about doing it. And so it might be beneficial, just because we have so much expertise on this group, to have one mini group working on the home-based piece and maybe combine that with MDHA, since that's already a process. And then another group that could be looking at the leveraging nonprofit church resources to find facilities for new centers, because centers is a different thing. Sure. That's just a suggestion, but that might organize the work a little bit in a little bit cleaner way.
That makes total sense to me. I'm going to move that up and kind of separate it. Y'all can see my screen now, yes?
Yes.
Okay, good. And so, did I do that? Yeah, Erica, and Lisa, are you signaling that you want to be on this subcommittee?
Well, I might, if it's okay, I may, I mean, I'm already doing that for my day job, but I may just hold back and see where I might be most needed, because I think there's probably a few groups I could be on, but I want to see where the rest of the group kind of orient themselves.
All right, but I'm going to put Erica there for now as we work through this. All right. All right, leveraging private sector, nonprofit, and church resources to find facilities for new centers. That's a pretty big task, and there might be other things I think that go along with that. Next is considering and encouraging community benefits agreements to include childcare facilities. That's something I'm definitely interested in, and in a fairly decent position to take part in that. I'm going to put my name there. Discuss transportation as an element of accessibility to centers. Getting data that helps us understand how many children are in need of childcare, what areas of town need more centers, what other data helps us in our mission. That's kind of a broad, like, as maybe each of the other subgroups will need to collect data to address that. So that's kind of a broader thing. Making sure they're quality teachers, they're well paid and have good benefits. Encourage employers to provide accessible childcare. Encourage participation in certificate program. I don't know. I mean, to some degree, we're looking at those potentially being micro centers, right? Or would we say that's a totally different?
I would say that that maybe its own category, the employer subsidized childcare, because that could be a micro center. It could be employers just subsidizing childcare in existing centers. That maybe could go a lot of different ways, and we should definitely be open to working with, or maybe even having. It'd be really interesting if this group had somebody on this group had a connection to have an early adopter, if you will, a corporate entity that's committed to this, that may be willing to go in on a recommendation or say, we'll start by doing this. I mean, that's sort of ideal, but.
Okay, and I think we mentioned that Dollar General might be a good company that's done it and might have some good evidence to share. All right, consider facilitation of networks. Does that go well with the resources above, with the leveraging private sector, nonprofit, and church resources?
I would say that is really its own separate thing, and because that's really working with existing childcare providers and facilitating them joining forces with others, if you will, to form an alliance. And there's a whole kind of thing to that. That seems like it's its own, because that's not necessarily expanding. That's really kind of creating operational efficiencies for centers that exist now.
Okay, that makes sense. Consider removing prohibitive regulations. That is something I'm doing research on. So I'll put my name on that. Whoop. Centers in high school, students that might intern to help. Is that something that can be worked into the academies? That would, somebody with a really good connection with metro schools that I'm sure many of us have. I think that would be, certainly talking and working with them. Assisting licensing off the radar childcare providers and resources. Does that go with anything else?
I think that goes with the home-based.
Yeah, I was just going to say that. I was also going to suggest at the very kind of opening line, to rather than talking about expanding childcare centers, if we could just say childcare providers, so that there's an
that makes sense.
Yeah, that goes with home-based care. That groups nicely.
Regulations largely go with home-based care too.
Yes. Sorry that I get close in on this screen. I'm a little blind, so.
Although I think, don't the regulations apply to center-based care as well? I mean, I think that goes to maybe one of Lisa's points about trying to start something for Bassberry and Sims and not being able to work the regulations.
Wow, okay.
That makes sense.
Yeah, the regulations piece is a big enough one that it impacts every single group.
Right.
So it's a big job, but I think, it's a good idea for you to be maybe our point person. And as we come up against things that we have questions about, we can put that on our list of things to change or want to change.
Gotcha.
Is there currently, if a center, is starting up and wants to get licensed, is there any resource to help with that process, or are they just kind of on their own to find someone to help, or does Metro help with that? Because that seems like a recommendation we could make. Yeah.
I don't know. I mean, just my knowledge of, I mean, it often seems like the state, at least for licensed preschools, I know the state is more of the guiding authority. I think there probably is a lack of that assistance. One of the reasons that we are doing the work that we're doing, that this committee has been convened.
Yes. So what happens is if someone wants to start a center, they really do have to connect with the state, and that can be hard to do. And there's rules and regulations, just a guidance document that goes through all the details if they're DHS licensed or DOE certified, but it can be so confusing. It's a labyrinth. And one of the gaps we've seen is that there really is a need for a local or regional entity to provide that. What you're talking about, Judy, that kind of, all right, let's look at this together, think about what you need, think about facilities and all of that kind of thing. But it doesn't really exist beyond if you can find a helpful person at the state to help you out, which is hard to do.
Like the Entrepreneur Center only specialized or something.
And I would add that Lisa, I don't know if I can share, but Lisa has been working on this to be able to create some type of opportunities in this space. So I would definitely, I'm sure she wouldn't say it, but I can say it that, because I am working to develop a network for home-based childcare providers, that we need something like an early learning collaborative, or there are other cities and counties that invest in a nonprofit entity to be able to do exactly what you all are talking about, to support new providers, new programs to serve their community. So there's a need, and there's an example of other cities and counties who are investing in this.
Could Metro Social Services, I mean, would that make sense to come underneath their auspices, or is it too big a job?
I would say that it's too big of a job. It really requires a dedicated kind of team to focus on early learning, because there's just so many factors that go into it. So the best examples that I've seen have been, again, other counties that have literally dedicated, resources and have an established nonprofit or a department of early learning themselves. Yeah.
Right.
I'm going to move these two, the one that is about transportation and teacher pay, a little bit away from the ones that relate more to centers, starting them and supporting them. They're both important, but are a little different. Is that okay?
I think that makes sense. Yeah.
All right. Did I go through them all? No, I didn't. Centers in high school, I left off there. And then support existing Head Start programs. I wonder if that goes well with anything else. Does that go well with facilitation of networks for existing centers? It kind of does, doesn't it?
Yeah, I forget from the first meeting what we meant by that. Maybe just that, we should have more opportunities for Head Start, or which goes to the, beyond childcare to other providers that are public, not small businesses like childcare. So
I gotcha.
yeah, I mean, I guess those could go together for the purposes of this.
Just in terms of, not that there aren't distinctions, but they're both about supporting existing centers, and it might look different for, I agree, it would look different for a private one and a Head Start. I know I do remember when we talked about supporting existing Head Start programs, we talked about how many seats there were and, expanding those. All right, we've gone through the list. Is there any, are there any, before I start seeing who wants to do what, are there anything else that we need to tweak in terms of those? I'll scroll through them one more time. Oops.
I would say for the line with the quality teachers, teacher pay, teacher training piece, the blueprint for success with United Way is digging really deep into that topic and developing some kind of policy recommendations from that space. So I don't know that this group would necessarily need to kind of I don't say duplicate that space, but I know that there's a great, strong team working on that piece. And I think some of the other bullet points are areas where Metro Council especially has a lot of power. So maybe we should focus on, or maybe we could focus on some of the areas where Metro Council can have even more power and impact.
Okay.
And I think that's true. And Eric and I are on that committee too, the teacher pay committee. And there's some very specific recommendations already come up. I guess this is a question, Tom. In our report, we could have a sort of state of childcare kind of thing at intro and have some recommendations, but then have a couple of specific ones that we're highlighting to say, hey, this is where Metro Council can do. Hey, this is one the mayor can do. And hey, this is one that, we need to pay attention to because it's really important, but it's moving ahead. But I don't know what you're envisioning in terms of the report, but I don't know.
I don't have a hard idea of exactly what it's going to look like. It's really up to us. Those are both about recommendations and potential legislation, so it makes sense to me. And I don't want us to commit to a format for the document, before we've kind of done our research and come up with our suggestions. So I think once we get more of that done, it'll be clearer to us what the report looks like. But what you're suggesting sounds perfectly appropriate.
Thank you.
All right. So are there other folks? I've got a few folks on here. Are there other things that folks feel like it's like that's something that I'm either already have thought about or done work on, or that's something I'd like to learn more about and make an impact on? And I don't think we need to feel married to just one, but let's especially if for like we might have one person that's kind of heading the making of the list or looking stuff up or doing research. But if there are other people that want to be a sounding board on that, I think being in a couple is okay. I'm happy doing that. But are there any jump out at anybody?
So I would say that this is Christy. I think the data piece is really interesting to me. I will start by saying I'm not sure where to look, but it feels like important information to find.
Yeah.
So that's of interest. And then also in thinking about, when I think about centers in high school, I'm also thinking about, like care for teachers' children. And I wonder if thinking about Metro as an employer, I wonder if that connects the pieces between employer-based childcare, and perhaps, like a law firm or somebody else who's looking for that. So the two things are interesting to me: data in general, and then just, I guess maybe center. It's hard because it's all connected, isn't it? So
Yeah, it is. It is. It is.
Either specifically, now that Lisa brought up the point, lots of ways for employers to provide support, right? Like it could be vouchers, or so that could be part of the data gathering, is what sort of revisions
Right.
are companies, supporting right now beyond the tax care, child care break.
Yeah. So I agree with what you've said. Are you wanting me to leave your name where data is and add it to the employers, or do you think there'll just be enough overlap that?
Well, leave me at data for sure, and then
Okay.
and then I could be like yes, I'm interested in the employers part too.
I'm going to put your name in just to keep notes. And
Okay.
all right. Anyone else?
This is Emily. I would love to join you, Christy, in looking at the data.
I'm sorry, in the
Data.
data.
I
Okay.
would love to work with you on that. And then I don't know if I can necessarily step up to like lead this, but I'd love to work with someone on like leveraging private sector, nonprofit, and church resources as well.
And this is Judy. I was thinking the same thing, Emily. I'm happy to reach out to some private sector and nonprofits and churches and just see. I don't know if we need kind of a specific attack plan, but I'm happy to start reaching out and say, have you ever thought about this? And it's not,
Sounds good.
it's not, can be done.
Yeah, agreed. And part of it is finding, part of that is, I think, useful, and part of it is finding someone responsible for doing that in an ongoing way, I think. All right. Anyone else?
I would love to be on the committee for the daycares in schools, and seeing if we could do credit for high school students.
Okay.
That sort of thing. And then wherever else I'm needed, I'm happy to plug in.
Yeah. Do you have a good school board or school system contact to work on that? Because I'm sure I could connect you with some folks.
I do, but would definitely not turn down a recommendation. So
Okay, we'll talk.
Okay.
Tom,
Yes.
either now or after everybody picks something, I can walk through each of these and give some contacts of people who are actually working on this right now.
That sounds great.
For each of these. So I can wait until everybody picks something, and then if we can walk through, I think we can all probably think of contacts for each committee to get started with.
Sounds good. All right, who have I not? Councilman. Oh, and Amy gave me a suggestion as to what she's interested in. Hold on just a second. That's actually something Amy's interested in as well, both the within schools and within workplace. Are those two things, those are pretty different things in some ways, except for the within a larger institution.
Yeah, those are different.
Yeah. Okay. All right. Councilmember Allen?
Yeah, do you have anybody for the home-based?
I thought I did.
Erica Ward.
Yeah.
I'll be on that too, since I'm
Yeah.
working with her. This is Lisa,
I mean,
sorry.
that constellation of three, if I can be useful there. I have no expertise, but I think there would be some zoning stuff that I could at least provide some knowledge on.
Yeah, that makes sense.
Tom, it's CKA in Erica's name.
I'm sorry?
In Erica's name, it's CKA.
Sorry.
There you go.
All right. Who have I? And wait, I didn't put, Lisa, you just said something and I didn't put you in, did I?
Oh, yeah, I'll be in the home-based care, the data group. And again, this is because I've already been working on this, so it may help the group have a little head start. And the let's see, what did we have done at the bottom?
I did get you.
The data, what's underneath transportation again? I was just thinking, oh, the networks. I'll be on that group too. And again, that's just because I have a lot of stuff for us to start with.
This one?
The facilitation of networks, yes.
All right, looks good.
So Tom, you didn't put me down. Is that?
I am so sorry. You were,
okay.
I'm sorry.
He says much more qualified and will be more helpful, but I'm happy to.
That was,
Home-based and off the radar and MDHA. That's a power team right there. I'm happy to join it.
there you go. I know, right? And I've already started looking at the codes and we'll have more that I can share. And I'm happy to help with that part of that.
Yes, I think that
That is
the
a
codes
separate-
piece, I would
that kind of
love
overlaps.
to work on that. We had a meeting with
Sorry. Sounds like
Gus at MDHA yesterday, and we were working on that right now. So
So it
we're
looks like-
actively problem solving around that.
And Tom, before you leave the codes piece,
okay.
there's two when you in the rules and regs for getting licensed, the two places where there can be the biggest holdup and sometimes barriers because the state leaves it up to completely to local codes. One is the fire codes for both home-based and center providers.
A loser?
And the other, it sounds so interesting
I don't
to
know
be
if it's
focused on
me or
this,
you,
but it's plumbing codes. The local codes for plumbing. And I say that because, oh, is there an echo?
Lisa, I'm sorry. I don't know if it's
Can you
me
hear
or
me?
you, but you break. Or no, they're half the time I can't. I heard you talk about plumbing.
Fire codes and plumbing codes. I have worked with a group of people who wanted to start home-based care in Upper Tennessee, and their local code stipulated that each home had to have at least one working water fountain in it, which is very unreasonable. And it was just little things like that come up, and when you don't always know that they're there, and home-based care providers, center providers are beholden to that. So those are two lines of inquiry to find out about.
Sounds good. So last time that we talked about the water fountain, I got the impression that that was a metro code above state code. But it's not what you said led me to believe that it's true in other localities too.
Yes, because the way the rules are written is that the childcare providers have to follow local codes, whatever they are, and related to plumbing and fire codes. So yeah, so local trumps state there, whatever the local codes say, which can definitely be a barrier to opening new programs.
Sure, and especially after we've learned so much in the last year about infectious disease. I mean, I believe my wife, who teaches 3-year-olds, told me that they are not using the water fountains now, and that they're kind of cautioned against it because it's such a community use. So I have a feeling that there's a really smart alternative to that. Plumbing and fire codes, I'll look more into. And like I said, I've asked Bill Herbert, codes director, and Director Cooper, our council director, who was also the director of law in the previous term, for guidance on that. All right. Has everybody chimed in? It seems like yes. Nancy Crutcher isn't with us. Was she with us last time? Anybody know Nancy?
I think she was there last time.
Okay.
Anybody
I'll
else
reach
can
out to
correct
her.
me, but I don't think so.
I'll reach out to her. All right, that's a pretty good. Okay. All right, I'll reach out to her. All right, I think that's a pretty good list. I'll clean this up and share it back with everybody. And, you know, I don't know that, you know, in going forward, I don't know that we necessarily need
Tom, you seem to be muted.
like subcommittees.
Can't hear you, Tom.
Hi. Hold on.
Now you're back.
Okay.
Okay.
I'm unmuted, so I don't know if it was my connection or whatnot. But what was I saying? I don't know that we need to have, you know, separate subcommittee Zoom meetings or WebEx meetings for these, and you know, maybe we can start sharing by email and phone.
Your audio is going in and out, Mr. Cash.
Can you hear me now?
Can hear you now.
Yeah.
Can you hear me now?
Let's try again. Yes. Like you're free.
Can you hear me now? Okay, I don't know. Okay.
You could try turning your
I'll try to
move. That help.
Turn the what? Oh, video off? All right. All right. I was just saying that you know, folks that have teamed up on some of these sub goals can do so however they want. I don't think we need to have, you know, subcommittee Zoom meetings, but sharing via email, I think, is fine, or setting up phone calls, sharing either research that you've come up with or brainstorming lists that you've come up with. Is fine to do it. I think I've sent emails with everybody's email address, so you can connect that way if need be. I'm thinking that like to schedule a meeting in like 3 weeks. That if we do it exactly 3 weeks, that would put us on, well, that would put us on March 2nd, which is a council meeting day. So maybe like March 3rd. We've had a pretty good turnout with noon meetings. So I think last time I got some feedback, there were a few people who either had a conflict with or did not prefer evening meetings. So I'm gonna move forward with like a March 3rd meeting, if that works for everybody, around the same time. So that kind of gives us a deadline or goal in terms of like having some, making some specific progress. All right, Lisa, you had said that you wanted to, that it would be smart to kind of go through, let me see if I can share again, to go through these and share like resources in terms of contacts, and maybe if you have ideas about where to get.
Yeah, I think so. The
Data.
groups don't have to start from scratch. We can all share where to start if you're in that group. I mean, some of the groups may already be well on their way, like our home-based care power group. We already have some good contacts there. I don't know if anyone else has one for us to reach out to, but we've got that. And in terms of I mean, I know you have the connection on the community benefits agreements, which is great. And Emily and Judy have the, looking for new centers and facilities. I would say that for Emily and Judy and you, Tom, that's a place where Gina Tech can be very valuable because that's one of the things that she and her team does. She's always on the lookout and in contact with people looking for new facilities, finding space. So Gina is a great source of information to get started on that one. Yeah. The data piece on that team, there's a few places, but Community Foundation has some data, and then I've got some already started, and then we can brainstorm together. So I think that the data group, we can get going, and we'll probably be reaching out to other people on this committee and further to get information we need, including from the mayor's office. I don't know if we have a primary contact in the mayor's office for this childcare work, but we may need some county level data. So I know we talked about that before. It might be Robert Fisher, but it might not be. I guess we can find that out. But for the employers, let me think about that one. I know that there are a couple people at the chamber. Samantha Perez at the Nashville Chamber actually is a great contact for Christy and Amy. They have already been, they've done an employer survey around childcare. They've been in touch with employers who may be interested in providing childcare for their employees. So that might be a good start, just so they can get going. I think I'd mentioned her to this group before. She's great, and they're so committed to this. So that could be a good start. And I can find out about the partner at Bassberry and how far that's gone, and circle back with Christine, Amy, myself. I don't really know if that's gone anywhere. But the next one down, is that the Metro one? Let's see. Okay, so I'll get started on the networks, but for the high schools and student intern academies, Renee Dillard at the United Way has been facilitating work groups for the Blueprint for Early Childhood Success. And one of those work groups is a teacher pipeline group that Erica and I are on, and some others. Jeremiah Davis is a gentleman who works for Metro Schools, and he has actually been working on the pilot program for this in Hunter's Lane. And I think there are actually 3 students right now that are going through the program to become early childhood certified, and they want to grow that program. Melanie Shinbaum, who is going to be here today, and Jeremiah and Renee would be the 3 people I would start with. And then that, I'm sure, can grow from there to learn about where Metro is and where Metro wants to go. But those might be a good starting place for that group as well.
All right. Sounds good. All right, I'll clean this up and share it.
Can I ask one more question?
Yeah.
And Erica knows more about this program than I do, but a program called Take a Leap Forward, which essentially was a way to have local government kind of subsidize part of the cost of childcare for certain residents. And I don't know if it was targeted at specific empowerment zones or people living under 200% of poverty, but I don't know if we would want to be bold enough to have a recommendation where Metro actually pilots a program or continues a program that helps to subsidize childcare for like poor single working mothers, or just put some money or skin in the game. I'm not sure if that's where we would want to go, but that's not really on our list. Erica, do you know more about the program? I'm probably not describing it well, but.
Well, yeah, Taking a Leap Forward is a program, an MDHA program that they receive funding, I believe through HUD, for that program to be able to provide subsidized childcare for residents in Cumberland View and some other select MDHA communities. And I think it definitely helps us think about ideas around subsidizing childcare to supplement the current kind of childcare certificate. So I know that first bullet point at the very top was, wanting to increase access to free and or affordable childcare. And, that particular piece right now, the only tool, or not the only tool, but the primary tool that we have for that is going to be that child care certificate, which is a way to subsidize the cost of childcare per family. That's operated essentially at the state level, right? And currently, for the state of Tennessee, through that program, we're only able to support 15% of the families who would actually qualify, right? Who actually demonstrate a financial need for that. So I think there's definitely a need for foundations, for corporations, and for Metro government, if possible, to supplement and create other opportunities for that free and affordable childcare.
Okay. Is that something I should add somewhere? You said MDHA is doing this, but we're looking at expanding that. So
MDHA currently has that grant, but that grant is actually being phased out. So there's going to be kind of this gap in funding.
Gotcha.
And so, yeah.
Okay.
And maybe, that is one program. It may not be that program. It may be an innovative approach that Metro government takes to say, hey, we're going to join forces with, I don't know, this foundation or this private sector, and we're going to have a fund, and we're going to help, I don't know what population you want to help, and partially subsidize, because the state subsidies just don't cover near the need. And so there could be some very innovative funding strategy that could be piloted, that Metro could start. We don't have that on the list, but it seems like that would a smart financing strategy or a way to augment existing funding might be really great, actually.
Does that kind of fit into this? If we are specific about grant, like resources could include grants.
I would think it'd be separate from that, because that's important to find facilities for new centers. It's certainly related, because the money that's needed, the money we're talking about, is actually subsidizing the cost of childcare for families or for single mothers, which is different than the cost to start a new program, some of which is facilities and space. They're certainly related, but it might be a different approach altogether.
All right, help me. I
might say, consider childcare subsidies from Metro government or some faction of funders. It could be an interesting public-private partnership to start to help families, and would be, gosh, especially with all the press and all the understanding that women have in the community about how incredibly difficult this pandemic has been on all parents, certainly all mothers, certainly poor single mothers trying to work and eke out a living. They need help. And so there could be an innovative approach we're not thinking of, but it could fall under this category to help them coming out of this pandemic.
That makes sense. Is there somebody that wants to take that on?
I'll volunteer since I brought it up. I've already been looking at that, so
Okay. Since it involves metro government, I'll add myself onto that too. All right. Any other? We were scheduled for an hour, and we've got about 7 minutes left. Like I said, I will clean this up and send it back out. And if there are any follow-up comments or revisions, that's wholly appropriate. Anyone else want to add anything? Oh, I did think of a question. Are there any, like we've talked about some of those individuals, would we like to kind of reach out to those resources, those individuals outside of these public meetings, committee meetings, or is there one that we think that would be good to invite to, say, the next meeting to share information? Not necessarily take the whole hour, but either be available for questions or, kind of be given a kind of task ahead of time in terms of, we'd like to hear more about this. Any thoughts on that?
Tom, this is Berkeley. I think maybe that could be driven by what the subcommittees do in the meantime. I mean, I think if one of us discovers, that we've had a really good conversation with someone outside the committee that we think everyone would benefit from hearing from, then we could let you know at least a week ahead of time or something like that.
That sounds good. That sounds good. And I know Melanie Schenbaum wants to join us and wasn't able to this time. So maybe if she's at the next meeting, we can, hear a little introduction from her and what her role has been. I think Lisa kind of mentioned it. Is she at Hunter's Lane, Lisa?
She's the director of St. Luke's program.
Oh, right. Okay.
Yeah. She's got a real good head for all of this because she's been a nonprofit leader for a long time, and so she knows the ins and outs of trying to run and a nonprofit and fundraise, and she knows childcare, and she's got a great policy mind too. So she's just a gem.
Okay. All right, sounds good. So if you all have suggestions for somebody to come and speak at the next meeting, let me know. I'm going to ask council staff to schedule the next meeting for March 3rd at noon. And they'll probably not right away, I'm thinking, but probably after the next council meeting. Well, Rosie, are you on? Oop.
Yes, sir.
I'll send you an official email about this, but generally, when are you all sending out committee things, like a week ahead of time, or?
Are you talking about for the agenda council meeting? Or?
For the next committee.
Oh,
meeting.
I go on and send it out and do a placeholder, and then I come back and add the WebEx information. So anytime
Okay.
next week, if you can let me know.
Okay, I'll do that.
Yeah, that'd be great. Thank you.
Thank you. All right, anything else? We're at almost at 1 o'clock. Is there anything else for the good of the group? Questions or comments or tasks?
Just to make sure that I'm on the right track. So essentially, whatever we signed up for, we're just kind of gathering information and then reporting it next time.
Yeah, and I would think as you gather information, if you come up with ideas or suggestions that you've brainstormed, that's definitely appropriate too, and we can share those with the group and see, if we want to amend those suggestions before we get to a final report, which we'll go through an editing process once we have documents and move through it that way. Make sense?
Thank you.
Yep. Thank you. All right. Anyone else?
And Tom, our end goal still is to have this report produced like maybe April, May. Do we have a definitive date or just in that time frame?
I don't have a definitive date.
Okay.
Yeah, kind of before we get too deep into budget, which is, hearings will start in like April. Is that right, Councilmember Allen?
I can't remember. Last year was accelerated, so it
Yeah.
may not be the same.
Okay. Yeah, I think early April is pushing it. I think late April, early May is reasonable.
Yeah.
Okay. Great.
All right. All right. Thank you all very much. I will see you next time, and feel free to reach out to me or anyone else on the committee.
Thanks.
Thank you.
Thanks. Take care.
Thank you.